Members of the panel, it's time and we have quorum. May I invite the officials to enter the committee room. So, Agenda 1. After the previous meeting, we have sent 3 documents to committee. Please note. So, items for discussion at the next meeting. So, for the next meeting, we will be discussing Secretary for Transport and Logistics briefing on the CE's 2026 policy address, and the second item is Universal Accessibility Program. For the next scheduled meeting, according to our schedule, would be on 16th of October, 8:45 to 10:45. Any comments? If not, we also ask our members to pay attention to the documents in the appendix of this meeting. Okay, agenda item number 3, proposal to enhance requirements for physical fitness certification of driving license applicants/holders. So may I invite government officials to make a brief presentation, and then we go to Q&A. If you have any questions, you could press the button first now. So may I hand over to Secretary Mabel Chan. Good morning, everyone. Today's agenda item is about road safety. Road safety is very much on our minds, as always. We have always adopted a multi-pronged approach to enhance road safety for road users. So today's proposal is about certification of driving license applicants. Apart from that, actually in terms of on-vehicle equipment, road design and planning, everything is based on road safety as our primary concern. In terms of certification of driving license, as the population ages, there are more and more older drivers these days. According to government statistics, 1 out of 3 commercial vehicle drivers are aged 65 or above. Therefore, we think current driving license applicants and holders certification mechanisms must be updated in order to help elderly drivers to prevent illnesses which may potentially impact their driving capabilities. We want to be able to identify and prevent this early in advance to establish a healthier way of living. That way, not only can we enhance road safety, we can also encourage a culture of safe driving. We also noticed that over the past 5 years, amongst the 10,000 plus traffic accidents where elderly drivers aged 65 or above are involved, 700 of those incidents are serious traffic accidents which involve casualties. The casualty ratio is 6.8%. Compared with the same ratio for people aged 65 or below is 1 percentage point higher. Therefore, we have conducted a review. We looked at experiences from both domestic and abroad, and we also listened to opinions and voices from all around Hong Kong. In particular, we are delighted to have a lot of valuable input from physicians and communications with the industry. In lieu of all of the different factors, the opinions of stakeholders and experience from cities, both domestic and abroad, we would like to propose 3 changes to our panel members. Firstly, we are going to tighten the physical fitness certification of driving license applicants/holders. In other words, we would move the bar from age 70 to age 65. Secondly, we would shorten the effective date of driving licenses for drivers of commercial vehicles age 65 or above, and would increase the frequency of health checks for these drivers to guarantee road safety. Thirdly, we are going to designate certain items of illnesses and disabilities which we deem inappropriate for commercial drivers to have. We already have a list currently for driving in general, and we would like to designate certain disability and physical conditions specifically applicable to commercial vehicle drivers. Over the past period of time, we have been engaging in high-intensity communications with our electrical members. In our implementation of this proposal, we really want to also launch a series of complementary measures. They are in threefold. We want to standardize our assessments. We want to digitalize and make the process both electronic and more transparent. In terms of our standards, our purpose is to establish a unified physical fitness guidance. So we want to offer a one-stop shop assessment service, but we also want to leave room for some physicians to give out referrals. We also collaborate with the hospital authority so that doctors can use the HA-Go system to issue these certifications so that the medical history of these drivers are easily accessible for certification purposes. In terms of transparent information, we would add a list of doctors so that drivers can easily access this list of doctors who can give out certification. And furthermore, we don't want to deter any drivers. We want everybody to engage in these screenings in advance. So we are actively discussing collaboration with frontline medical services to offer more synergy after discussions with the hospital authority to help these drivers to continue to manage their health. Time is of essence here. We have already used some time to listen to people's advice to optimize our proposals. In the future, within this year, we expect to table this proposal onto the LegCo. Maybe after the summer holidays. We're going to do it as soon as possible and start to prepare. Our goal is to implement the new physical fitness certification by Q2 next year and other relevant measures. Chairman, my colleague, Mr. Tony Yip Ka-sing, the Deputy Secretary for Transport and Logistics, have a slide prepared to introduce the details of this proposal. Thank you. Thank you, Ms. Mabel Chan. Thank you, panel members. So may I now jump into a further discussion of the proposal. As our secretary has mentioned, the demographics of our city is getting older. There are more and more older drivers. In order to enhance road safety, we have conducted an internal review looking at experience from both domestic Chinese cities and cities abroad. Generally speaking, we have seen age-based risk control measures, and we adopt a higher standard for commercial vehicle drivers, starting earlier and more frequent health assessments and more stricter health requirements. In consideration of Hong Kong situation, we believe that we have to optimize and align our standards with those experiences. Ms. Mabel Chan has already covered our three major proposals, but I'm going to address this in three angles in terms of proposal to amend the law, the relevant complementary measures, and areas where we can continue to optimize. And I'll briefly introduce those to everyone. Firstly, in terms of amendments to existing law, we're going to amend CAP 374B, focusing on three areas. Firstly, what is counted as disability and illnesses under that law will be amended. Firstly, we will recommend that this list is not applicable to all driving requirements, and we are optimize the visual aspects of the law. We will add field of view and visual acuity as two new standards to align our standards with other areas. Secondly, we are going to tighten the commercial passenger vehicle physical fitness check. We would have earlier, higher bar, a lower age for the standards, and also shorten the effective date of these licenses. So we are going to include other illnesses such as partial visual disability, night blindness, etc. You can refer to our proposal for details. Thirdly, Secondly, we are going to reduce the effective date for the license and also tighten the restrictions for physical check for commercial vehicles. The requirement for submitting your physical fitness check will no longer be 70, it will be 65 years old instead, and the effective date of the license will be shortened. So for people aged 65 to 67, you will get a 3-year effective date. For 68 to 69, it's 2 years. If you're 70 or above, you're only issued a license which is effective for 1 year. Simply put, after age 70, all of these commercial drivers would have to have a health check annually. And you can refer to Appendix 3 for a contrast between the existing proposals and the existing practice. And thirdly, we would empower the Secretary for Transport and Logistics to have a right to require a physical fitness certification report. Right now, there is no clear law to regulate what happens in these cases. In order to for road safety, we state that the Transport and Logistical Secretary can ask drivers to submit a physical fitness certification. If they are unwilling to do so, the secretary may suspend their license or refuse to extend their license. This is only applicable for drivers which may not be healthy. It does not affect healthy drivers, and the department is going to rigorously implement these powers. We are only going to take any action if we suspect there is any relevant case to be handled here. And secondly, relevant complementary measures. Firstly, as Ms. Mabel Chan has mentioned, we are going to standardize our assessment. We will have a brand new assessment guidance, systematically list out all of the necessary criteria, so all physicians can make the assessment according to a standardized criteria. In Q4 last year, we have already launched a pilot scheme for some physicians and elderly drivers. We have received positive feedback. Physicians who participated in this guidance generally think that this is practicable and pragmatic, and the drivers are generally satisfied with the arrangements. We have learned from the experience to further optimize our proposals. After the law passes, we are going to start to educate our doctors and issue materials for physicians to reference. And secondly, when we set these standardized, we thought about the equipment available in general clinics. Most doctors can have a one-stop shop experience having family doctors to conduct the physical exam. And we also have some flexibility here. If doctors think that some functionalities need to be further tested for certain cases, they can refer it to specialist physicians after clinical examination. The benefit of this is that on the one hand, we can make sure there's a comprehensive fitness check, but on the other hand, we could avoid excessively complicating matters, suiting everybody's needs. Secondly, we want the process to be digitalized. We are going to work with the HA so that doctors can use HA Go to issue physical fitness check certification so that the assessment results could directly be sent to the Transport and Logistics Secretary. And thirdly, through the government app, both doctors and drivers can look at the medical records so to increase transparency. Furthermore, we would like to increase a search for the relevant doctors function in the government application so that drivers can easily find the relevant doctors. We also actively educate and encourage more doctors to provide such services. At the same time, we are going to guide elderly drivers towards taking health checks, and not only that, we want to make them manage their health even more and make use of frontline medical services. We are going to collaborate with various departments on that front. In terms of future optimizations, we are going to continue to follow up on how to use innovative technology and AI to further help us roll out standardized health fitness checks in order to assess the capabilities of elderly drivers. We're going to learn from experiences abroad. As Ms. Mabel Chan has mentioned, we may introduce some Chinese standard medical equipments to see if such medical equipment can help Hong Kong engage in such standardized health checks. and we conduct a feasibility study on that. And secondly, we take an open attitude towards other long-term solutions, including further standardization of our assessment, including introducing medical or fitness check centers.
The above are my main points of presentation. Okay, thank you. Many members would like to ask questions. Let me read out their name. Lee Chen Kang, Chang Ho Fong, Lau Ka Kang, Lam Wai Kong, Aaron Bob, David Lam, Adrian Ho, Eric Yim, Chan Siu Hong, Chang Pui Kong, Chao Siu Chung, Lothar Lam, and myself. So 4 minutes for each member, including question and answer. Mr. Lee Chen Kang. Good morning, Chairman. Thank you, government, for listening to views of the transport trade. So in other words, so from 65 years old down to 3 to 1. So 65 years, 3 years old, once every 3 years, and then 68 to 71. So if there is only one check per year for those over 70 years old, then the burden may be too high. For physical fitness check, for Hong Kong companies, well, they charge more than $1,000 per package. So are you going to work with the hospital authority or some medical check organizations to offer some concessionary package to these drivers? Now, if things are too expensive for those part-time drivers, they may choose to retire instead of paying this amount of money every year. So can this be considered? Secondly, can you offer some encouragement measures so that aged drivers can wear, for instance, smart wristbands? Now, these smart wristbands can detect blood pressure, ESG, oxygen concentration in blood, and so on, instantly on a real-time basis. If there are any issues, then alerts can be shown on the mobile phone or sent to family members so that perhaps they can avoid driving that day to avoid accidents. Thank you. Secretary, thank you, Mr. Lee. Thank you for helping us communicate with the trade. I would like to emphasize that for our recommendation, overall speaking, we are tightening the regime to enhance road safety. So there are 2 points here. First, CV drivers age to take physical fitness examination. So it is a tightened measure from 70 years old to 65. And then for those over 65, well, the frequency of physical fitness check will have to increase. So in the past, only those over 70 need to do it. So those below 70 do not need to be subject to this examination frequency. Now we have enhanced the frequency. As regards the frequency, of course, we need to strike a balance. So we have worked with the medical sector. At the same time, we have appointed the Li Ka-shing Medical College of Hong Kong U, their public health expert team. So we have close communication with the medical sector. We have been talking about the fees for medical check currently. So in the future, assessment guidelines will be standardized. And then we hope that there would be some focal assessment directions. So we will continue our efforts and our work. So for medical practitioners who can do physical fitness check, or if there can be district physical fitness assessment centers, then we hope that the price will be closer to drivers' affordability. And then the second point is smart measures. Just now, you mentioned smart wristband and also some devices in vehicles so that drivers' driving condition can be monitored. Now, with smart development and technology, we will continue to enhance our approach. Thank you. Mr. Chong Ho Fung. Thank you, Chairman. So I think we have been talking a lot about aged drivers, and we do support the government's work in this regard. Now, I have 4 questions and suggestions. First, one check every year for those 70 years or above. So we assume that after the physical fitness assessment, there won't be a problem. However, shortly after the assessment, if there is a serious traffic accident, then what is the problem? Is it because of problem during the assessment? Is it because the one conducting the assessment is too lousy, or that the physical condition of the driver changed so rapidly? So if shortly after the physical fitness assessment there is serious accident, I think these cases should be referred to the medical association to see whether there is negligence. And then apart from physical fitness, fatigue and also degree of concentration would also affect driving. So let's say if the drivers can not really focus after some time, then there would be higher chance of accidents. And then regarding cost effectiveness, well, I think the maximum working hours may not be applicable. So we support a mandatory retirement age. Where should we draw the line? I think this can be discussed. Mandatory retirement age may bring about practical problems to the trade, but we are talking about human lives, so there may be other solutions. We cannot avoid this issue. And then the paper states that you will take reference from other countries on the use of INT and smart development. Some years ago, the government said that they would do some studies, but so far we still have not got a timetable. Are you going to present a timetable? So if this is feasible, what will you do? If not, then why? Please do not prolong the study. And finally, are you going to add some, for example, light signals in the car, like yellow light, so that passengers will know whether there has been one examination annually? Now, for taxis, the drivers work on shift. So are you going to put some signage or light signals so that passengers can tell whether they would like to patronize that particular driver? Well, this may involve privacy or confidentiality, but then we're talking about human lives. So I hope that you can put up a solution. Secretary, thank you, Mr. Chong, for recommending so many innovative ideas. I need to give a practical response. Just now, you said that we are tightening the physical fitness exam arrangement for CV drivers. I want to say that there are different factors behind accidents, apart from personal factors. For example, the on-site environment and other road users are some factors. So just now, member said that when we have tightened this measure about physical fitness examination, if some cases involve aged drivers, that there are accidents, then will there be doubts about the physical fitness examination that we need to follow up? Or you mentioned that other organizations may have to follow up. Sorry, I think that this is not quite practical or realistic. We have to standardize the assessment and clarify the assessments so that people will have confidence and there is clear guideline. Secondly, you mentioned mandatory retirement age. We have an open mind about this. In different places overseas, including the mainland, they have this arrangement, especially for commercial vehicle drivers. So there is an upper age limit for them. The proposal today is just the first step. We believe that we should take this first step as soon as possible. But should there be an upper age limit? What age should be that limit? We need to gather more information and listen to members and the trade's views. Regarding more use of technology, thank you, Mr. Chong, for your comments. Actually, now we are working hard. The Transport Department will do some research. On the mainland, there are some self-help self-service health check kiosks about vision, response, and hearing. So that can be objective examination, and it is quite convenient. However, these measures are such that at the back office, there must be a medical team to support the work. I know that the transport department is planning this, and in the future, very soon, they will order these self-service health check kiosks as pilot projects for further studies. Just now, the member also said that some signs can be added in the car about driver's age and other information. As the member said, this involves drivers' personal information and condition, especially their age. So there may be the consideration about age discrimination. However, overall speaking, we will consider all useful comments in order to enhance passengers' confidence in riding commercial vehicles. Right, for physical fitness assessments, sorry, please follow up on other occasions because your time is up. Well, after Mr. Lau Ka-keung speaks, I will draw a line. So members who are here who would like to speak, please come down to press the button as soon as possible. Mr. Lau, thank you, Chairman. I am concerned about aged drivers' driving safety. And some time ago, I also asked a question, getting response from the administration. This time, about physical fitness examination requirements, the administration is proposing this solution to protect road safety. Now, I support the proposal. In para 12, it says that for non-CV drivers, the age requirement for them to present medical examination certificate won't change. In other words, 70 years old. But practically speaking, many CV drivers, like drivers to private individuals, do not need to get the CV license. So can you suggest ways to protect themselves as well as road user safety? And then there are designated diseases and also physical disability items. That is road traffic driving licenses regulation schedule 1. So for general clinic, they can also do physical check for drivers. How can you ensure that these clinics are well equipped with the necessary equipment to do all the tests about vision, visual acuity, visual field, hearing, and so on? Now, drivers sometimes doze off, and that caused traffic accidents. And those who have sleeping apnea will doze off easily. So many places have listed this as one of the medical check items. So do you think that you will add all these illnesses and also some hidden problems in the scope of physical fitness assessment? Thank you. Thank you, Mr. Lau. So you have given quite a lot of comments. So we will continue to follow up your comments, and we will continue to enhance the measures. Overall, I'm thankful for you. So I think that we need to enhance CV drivers and non-CV drivers' awareness about their physical fitness. Apart from enhancing the legislation, I think encouragement and publicity is important. So just now you said that even though in the laws there is no rigid requirement on how to improve the situation, well, we can also go through the primary healthcare system and e-health so that it would be convenient for members of the public to take medical examination. So I think we can work with the Health Bureau in this regard. And just now you mentioned that during physical fitness assessments, are there enough equipment or expertise in order to test on all the items set out in Schedule 1? So we are aware of that. So the Transport Department had commissioned our experts team, and we have communicated with medical experts. Last year, the Transport Department launched a pilot scheme. So regarding our recommendation, there are also some small doctor teams taking part.
We also invite some volunteers from commercial vehicle drivers to participate, and we have received positive feedback, and we believe the proposals are pragmatic. What about hidden medical conditions? On that front, we believe that we are trying, we hope, after listening to experts' advice on Schedule 1, we are going to add a new list in the future to list out conditions that we think are more serious that can be clearly defined. In the past, we have also heard advice for expansion or detraction from that list. We're going to take it into further consideration. So the most serious and most clear-cut cases will be included in the law, but we are working on it as we speak. Thank you. Lam Wai Kong, please. Thank you, Chairman. I'd like to thank the Secretary for mentioning that there are many reasons behind any traffic accidents. Of course, the driver bears the brunt of the responsibility. Earlier on this year, in July, I have made a question on age and how it correlates with traffic accidents. I'd like to supplement that. When the Transport Logistics Bureau handled this, the highest the three age groups, which are 40 to all the way to 60, which are actually have highest frequency of highest number of accidents. But highest frequency of accidents actually come from younger drivers, age 20s. So what I want to point out is that age is not necessarily a factor contributing to traffic accidents. So this time, with respect to CV drivers, after they are 65 or above, they have to do a health check. Generally speaking, sometimes drivers do not necessarily understand why, and I do hear those voices. I'd like to thank the Secretary as well. In terms of arrangement for the fitness check, they heard voices from the unions and adopt this 1, 2, 3 model, which is relatively more acceptable to the unions. In terms of its executions, there are some things that I wish to clarify. Firstly, these days, a lot of commercial vehicles, particularly taxi and minibus drivers, they do not have a stable income. Particularly for minibus drivers, the median income is about 14,000. In the short term, can there be any subsidies so that to subsidize the cost of fitness checks to reduce the burden on their shoulders? That's the first point. And secondly, in your introduction, I also noticed that there was going to be a standardized criteria for physical checks. So if there's a standardized criteria, could there also be a standardized cost of that fitness check so that drivers would know how much it is cost, so they won't pay different sums depending on the physician? Thirdly, in terms of health check arrangements, we see that it's relatively simple, and there are going to be family doctors who handle this. In the future, will we consider allowing government departments to provide such fitness check services so that commercial vehicle drivers can go to government departments to have their health checked? And the relevant fitness check report, after you receive that report, can that be then taken to public hospitals as a supplement for their own health check fitness certification? Thank you, Chairman. Thank you, Mr. Lam, for his input. He has always given a lot of input and a lot of very precious input from our drivers. I'd like to thank him for that. And I understand that different stakeholders in the industries all proposed that maybe we have tightened the requirements, and you are now required to check your health earlier than before. Maybe a subsidy to go along with that would be better. I've heard those voices. And we have been actively working with the Health Bureau on that front. According to our understanding, the health vouchers are applicable in this area. So I'm sure that everybody knows that for any elderly, even if they want to do a regular fitness check, they can already use medical vouchers. We believe that that would help lessen their burden. In terms of a standardized criteria, well, since the issue is standardized, when family clinics engage in this health check, we believe the amount of time and resources needed for this check will also be gradually standardized. I can offer another statistic. Right now, more than 80% of doctors are now already registered on the e-health system. So this is a supply and demand issue. We think as long as there's sufficient supply, the fees may be driven down and be standardized. Our current approach is to rely on market forces to provide such services. And in terms of the fees, we hope that there's a room for gradual adjustment. Thank you. Okay, so Mr. Lam also asked about, roughly speaking, how much will it cost? If you have relevant information, perhaps you can follow up with Mr. Lam afterwards. So, Mr. Aaron Bok, please. Thank you, Chairman. Of course, road safety is my primary concern to protect the life and livelihoods of our citizens. So I support this proposal. Well, these days, people are old, yes, but most of them are healthy. So we hope that they could have this one-stop shop health check and pass the certification. As I've said, market forces, if there are more doctors who can provide these services, I believe the fees will be driven down. Two questions. Firstly, on paragraph 25 of the document, you mentioned that you would use technology to help road safety, but you said that it is only limited to monitoring the physical conditions of these drivers. You didn't talk about the number of hours these drivers are driving. And these days, bus drivers, for example, it's only a voluntary restriction on their working hours. There's no legal mandate there. And private drivers and truck drivers, they are not limited by these restrictions. So long-term driving, insufficient rest is also a major source of safety risk. So may I ask, on top of these proposals, will there be a maximum hours that a driver can drive to be legally mandated as well, and force them to take rest after that? And secondly, this type of proposals covers visual, auditory, and cognition issues, etc. But poor sleep and even using of psychoactive drugs are often associated with people driving while tired. Will these criteria be included in the standardized health checks as well? Because these things are very important as well, because insufficient sleep is indeed a killer on the road. Thank you. Thank you, Councillor Bok. So two points. Firstly, in terms of maximum hours or guidance of how many hours a driver can work, and exploring whether there should be a mandatory maximum limit. In the past, every now and then, this is an issue that have been raised, and it is somewhat controversial. Of course, we understand and we encourage the employers of commercial vehicle drivers to pay attention to the state, the mental state, and the fatigue of these drivers. Therefore, in terms of bus drivers, we have always followed our guidance through our franchising, licensing, contract articles. We actively encourage bus operators to limit the bus drivers' working hours and their resting hours, to give a very detailed guideline on that. Over the years, this has worked very well. But if we were to expand such measures to other areas, or even legislate, if we look at experience from other places, this is not actually a common occurrence. So we have to be very cautious of that. Furthermore, you mentioned fatigue driving and the factors attributable to that, including sleep quality or other physical conditions. Indeed, in the past, we have collaborated with a Hong Kong university and to conduct research on fatigue, driving while fatigued, and conducted research on that. In the future, we are going to continue to do more research in many aspects, possibly. For buses, we also have a forward-looking measure. We would have fatigue driving monitoring systems or even coming with an alert. And on these vehicles, we are going to install smart devices to correct them when they perhaps drive on the wrong lane or when they're about to crash into a vehicle in the front, etc. We will have arrangements on those fronts. So I believe we must take a multidimensional approach in handling and researching these issues. If we are just relying on a certain state or a certain medical condition, then it goes back to the issue of whether the doctors have a clear, standardized criteria in their fitness checks. So we have to balance both concerns. Thank you. So, Mr. David Lam, please. I have to respond. There are many reasons behind poor sleep quality, and if you control sleep apnea well, you wouldn't feel fatigued during daytime. So this is a bit of a supplementary information. I'd like to go back to the proposal on Appendix 2. There are some additional conditions, but I want to ask about one thing that is not included. I see that there are two experts here. Right now, the expression is inconsistent with the experts' advice. So these days, according to existing guidelines, if a driver has epilepsy, there is no way that they can get a license. So it's clearly stated on the law, right? If you have any medical conditions on Schedule 1, then the Transport Secretary must reject your application. So if the person have epilepsy, even if there is no epilepsy over a decade, even if the doctor feels that he or she is very stable, currently the law does not give them any hope of getting a license, which is a divergent from expert advice. The experts are quite clear. If the experts believe that if the doctor feels that the condition is stable, we can give them a license. Well, it could be you could be born with epilepsy, right? But they do not actually have epilepsy symptoms, right? That could be the case. I'd like to clarify that because there are different measures, different standards across the world. If you are inclined to let a person with epilepsy to have a license, provided their medical condition is stable, you have to state it clearly. That's my first point. And secondly, doctors or physicians or medical experts, the assessment that they do right now, they would say that they would write it, they would provide a form, and the doctor would give just a fitness certification, right? But that's all part of medical assessment. It's part of that individual, that patient's medical records. I hope that as soon as possible, we can see that your bureau and the health bureau can automatically can communicate, can put that medical record automatically onto the e-health system, including medical assessment before they start to drive. This is a very valuable piece of medical information for doctors to reference. Thirdly, right now on Appendix 3, that table is a bit strange. So I'm sure that Councillor Fong Kwok Shan is going to, Christine Fong is going to ask about that later. On the far right column, a column says that is the 1 day or one day before your 65th birthday, and then is that wrong? That shouldn't be there because you have starting from 65, 3 years, 2 years, and 1 year. So you have 59 to 55 to 59, and 60 to 64. There's nothing there. Is that wrong? So if it is, I hope that for commercial vehicles which started to have a healthy fitness check, which is 3 years, once every 3 years, I want it to be all standardized for 65 years old. So thirdly, how do you define commercial vehicle drivers? Does it include like internet rail hiding services? Thank you, Chairman. For epilepsy, I've already listened to Councillor Lam's advice, and we are going to consider in the formal legal law amendments, we can see if there's anything that we could improve on. And in terms of collaboration on the e-health front with the Health Bureau, we definitely agree that e-health, regardless of you're a driver or not, it helps citizens to grasp their own health conditions. It's a fantastic tool. We hope that through e-health, physicians who supply these health fitness check services can provide an electronic certificate for the fitness check so that for any given driver or any given citizen, they can access the health checks, fitness checks that they have done in the past through e-health. And that also helps them in like future medical consultations. They can know about their own health conditions, and another doctor could also access these e-health records to help that patient.
跟住個附表。
My answer about Schedule 3 has not been answered, and also the internet or online health driver. Right. Thank you, Chairman. 1 day or 1 year before 65th birthday, well, here this means that it starts from 55 years old. Now, the current approach is that the validity can be 10 years at most. If a person applies when he is 64 and a half years old, then that is less than 1 year before 65. So he can go around this requirement. Okay, so that means 1 day or 1 year before 65th birthday, the longer one prevails. Now, there is no content there. So you should draw a line at the place that I read out just now. So 55 to 64 years, one check every 10 years. So is there a mistake in your table? I'm not saying that your policy is wrong. If that's the case, now for CV drivers, so 3 to 1 since 65 years old, then how come for non-CV drivers they start from 60 years old? Okay, I think this is about the validity of the driving license. Yes, this is the validity period of the driving license, not about physical fitness test. I see. So perhaps you can look further into this later, and if necessary, please contact with Mr. Lam. So I have to manage time properly today because we cannot extend this meeting for too long. Mr. Adrian Ho, thank you, Chairman. Today, I do support the administration for enhancing the physical fitness test in terms of the timing and also the specification. I think in relation to perception of the residents and also the possibility of reducing accidents, I think it would be helpful. Now, I have a few questions for the Secretary. First, about assessment. So under this amended system or revised system about physical fitness examination, how many CV drivers will not be able to pass the requirements and so the license cannot be renewed? And in this assessment, how many of these drivers will be taxi drivers? With the new system, how many accidents can be avoided involving CV drivers? Those accidents that are caused because of the age of the driver. Now, if the new system cannot effectively identify those drivers who are not suitable to drive, then at the end of the day, it will be these same drivers who will continue to drive. Then concerning the effect on improving road safety will be limited. Then as such, will the administration put in place some concrete review measures? After some time when this system is put in place, if there is no apparent decrease in related traffic accidents, then will the administration immediately do another review to enhance the requirement on physical fitness and also related arrangements? Secretary, thank you, Mr. Ho. I think your points are very important. We need to continue to enhance road safety. That is our topmost priority. So, of course, now, concerning the driving license holders and different vehicle types, we do know their age distribution. Last year, the Transport Department conducted a pilot scheme. The purpose is to look at how to enhance the guidelines. And for CV drivers, we want to look into the situation on the impact on those CV drivers with our recommendation put in place. So we can see that most drivers are able to pass the assessment. Well, in relation to visual acuity, perhaps we will have to give them reminders on more frequent check of their eyes. So we believe that early physical fitness examination, early detection will be helpful to extend drivers' driving span or driving age. Every year, we will do analysis of traffic accident rate and the age distribution. Just now, Mr. Lam Wai Kong made this point as well. So we did not see a sharp increase in traffic accidents in a certain age bracket. But as said in my introductory remarks, those over 65 years old, those CV drivers being involved in fatal or serious traffic accidents are bigger in numbers compared with other age brackets. So we have to be more targeted. Of course, we do want to carry out consistent review. So if there are areas for improvement, just now the member talked about upper age limit. Are we going to do a review? We hold an open mind on this. Thank you. Mr. Eric Yim. Thank you, Chairman. I have two questions and one suggestion. First, question is for the Secretary. Para 14 of the paper states that if there is suspicion that the drivers have certain illnesses, then their driving license will be rescinded. And within 3 years, they have to present physical fitness report or medical report. And then if there is no longer such disease or physical disease, then TD may rescind its decision and reinstate the driving license. So why 3 years? So you may want to ask for medical reports in 3 months' time, but how come you are talking about 3 years? So let's say if the driver has a heart problem after 3 years, if he has undergone operation, then so you are going to give him driving license within 3 years if he has no longer the illness. If his situation stabilizes, so you will consider issuing driving license to him, right? That's the first question. Secondly, factors affecting driving safety. One of the factors is heart failure, sudden heart failure in drivers. And these conditions cannot be detected immediately. So this may be because of fatigue or long-term stress. Now, the Transport Department has ruled that for bus drivers, they have to take a rest or break for 14 minutes after working for 6 hours continuously. But then it is difficult to regulate the taxi drivers. So for those drivers over 60 years old or 80 years old, they are non-bus drivers. For bus drivers, you can regulate them, but for non-bus drivers, you cannot. So the Secretary just mentioned that there are technology means, for example, some smart devices to be installed on the taxis so that when they have driven for 4 or 5 hours, they should take a break. So will the administration make further rules on these? My last suggestion is the Secretary just said that for upper age limit of CV drivers, you will adopt an open mind and may do further studies. I think that you should do this as soon as possible, especially for CV drivers, especially for drivers of large mode of transport like bus drivers. You should set an age limit at 80. Well, they may not show any problem in their medical report. However, when people age, their response will become slower. So 0.5 second late in response may lead to traffic accidents. So I think that 80 years old should be the upper limit. Thank you. I think I will comment on the second and third questions, and I guess the Commissioner can answer the first question. First of all, regarding devices, smart devices in vehicles, well, they can enhance safety and also remind the drivers and monitor or detect the driver's conditions so that there can be prevention. We are doing studies towards this direction. For franchised bus, we have already put this in practice, and it is mandatory. For minibus, taxi fleets, or other online hailing service or operators, we can move towards this direction. And I would like to thank Mr. Yim for his suggestion on CV drivers' upper age limit. So he suggested an age. We have listened to that. We will continue to do further study and review. Because of time, Commissioner, please be precise in your supplements. Yes, just one point. Para 14 of the paper. Yes, we would like to offer some flexibility to relevant people. Within 3 years, if they can prove that they have not suffered from those diseases, then their driving license can be reinstated. So there is this flexibility. Okay, next, Mr. Chan Siu-hong, please try to be brief in your questions. So let's have brief questions and brief answers. Mr. Chan, thank you, Chairman. Physical condition and mental state of CV drivers, this is important to road safety. Road safety is very important. Even one accident is too much. So this time we are talking about enhancing physical fitness certification requirement for CV drivers. I'm in support. In 2023, we discussed this in the panel, and then after that, the administration has done some studies and consulted the trade as well. Last month, on the 17th of June, during LegCo meeting, there was discussion, or there was an oral question about enhancing professional drivers' driving safety measures. And at that time, the Secretary did not mention this revision from one check 1 year. So it is just 1 month. How come there is such a big change, Secretary? Or it's just that you did not announce it at that time? But then you have been working on it for some time. I think we welcome this new proposal. It is better than one examination every year. Now, my concrete question is, if there are CV drivers who are 64 years old when they renew their license, so will you renew their license for 4 years? And then before 70 years old, the driving license will still be renewed all the way till 70. And then after that, there will be one examination 1 year. This is a question from some drivers. And then regarding the physical fitness assessments, well, there is a questionnaire to be assessed by a group of experts. And in most of the questions, they are asked about whether they suffer from certain diseases. So there is a lack of objectivity. Now, we only rely on information in e-health. And we rely on the drivers to provide further information. So how can you ensure that they will not make fake declaration? So some time ago, last year, for eligibility of certificates for local vessels or local vessel operators and seafarers, well, I would like to know the difference between that physical examination and the physical fitness assessment that we are talking about for CV drivers. What are the differences?
Thank you, Councillor. A lot of details about the question. I'm sure that we'll follow up on those details with Councillor Chan after the meeting, but I'd like to respond to several points. We are restricting the fitness check requirements for commercial vehicle drivers and how that affects the continuation of their validity of the driver's license. The direction is consistent, right? As we've said, we are inclined to restrict that. And indeed, as Councillor Chan has mentioned, in the past, in several meetings of the Transport Affairs panel, every time we've listened to your input, and after that we have continued to follow up with councillors and engage in continuous discussions with the trades. We want to build a consensus and make sure that the proposals are pragmatic and can be implemented properly. Of course, people have concerns about the frequency of the checks, but this is the first step. The most important thing is to take a first step. Starting from this age, we have to do a fitness check. We want to raise the bar so people have to do fitness checks earlier than before. That's the most important thing. On the e-health, as we've said, we are going to be working in close collaboration with the Health Bureau so that the relevant medical records on the fitness check records can be put on e-health, and to enhance transparency could be shared easily to help us follow up on that. For the sailors and mariners and how do they compare with commercial vehicles, like the two departments do learn from each other. It is important, but the conditions you face in driving might not be entirely the same. So perhaps we can talk about this after the meeting. Okay, so for the question on age 64 and above, we're going to talk about that later after the meeting. Cheng Pui Gong, thank you, Chairman. Yes, I do encourage using technology more to enhance road safety and driver safety. And the Secretary's comments and the documents both reflect that. My question is that 40% of buses have already installed a driver monitoring system. So you are considering to mandate all buses to install that system. I want to know if that plan is carried out already or not, and what's the timeline on that. Secondly, for the taxi fleet, we have installed some driver monitoring system. The Transport Bureau have said that they have to review and study the feasibility and cost efficacy. I want to know how long will that take? How long do you plan to research it for? Do you have a timeline for that as well? Because I do believe that using technology, it cannot wait. There are some sensors you can put on the front of the vehicle when there are sudden accidents. That you could slow down or even stop the vehicle. This is not new technology. My car is several years old and it has that technology on board already. Could you look into that, please? Okay, thank you. Within this month, we have already spoken with the bus franchisees to update the agreement. Mandating that all buses must install this monitoring system. And secondly, on taxi fleet, as you know that this is first rolled out July last year. It's just 1 year since. So we are continuously reviewing the operations in many aspects. The systems that the councillor have mentioned, we are going to review its efficacy altogether as well. Thank you. Councillor Chow Siu Chong, please. Thank you, Chairman. Well, thank you, Secretary. On this issue, we have listened to a lot of opinions. Almost 2.5 years ago, when we discussed this on the panel, I have already made my voice heard. I agree. For the sake of road safety, enhancing health fitness checks of commercial vehicle drivers, I agree with that work. Matter of fact is that for the age group 65 to 70, medically speaking, there is no specific piece of information which suggests that people of this age group shouldn't drive. And if you look at actual safety data, as the Secretary and her colleagues have mentioned, it's not necessarily that this age group is particularly accident prone. So on the one hand, we have to protect road safety and safety of our citizens, but on the other hand, we also have to think about the livelihoods of these drivers, because in Hong Kong, professional drivers don't get to retire at age 65. After that job, they have to find another job. And after 65, they have to find another job, and then they drive bus, taxis, and minibuses. So they can't stop. So the government's proposal have to take into consideration to strike a balance between safety and the livelihood of drivers, and I support that proposal. Secondly, on the costs of the fitness check, yes, it can be paid by medical voucher. That's also a brilliant measure. May I remind the government, when you actually implement these proposals, you have to pay attention to whether the doctors are willing to deliver these services, because I know right now current fitness checks cost $300 to $500, and they last just 3 to 5 minutes. But in the future, if you want a doctor to spend half an hour to do this, are they willing to do that? Will it be difficult to find a doctor who's willing to deliver such services? I hope that the Bureau can dynamically monitor the situation and, if necessary, make relevant adjustments. Secondly, on the fee side, please check up on that. Don't impose too much of a burden on our drivers. And finally, after the policy is rolled out, will the Bureau conduct a survey? Will that drive the number of drivers down significantly? When I refer to paragraph 16, you said that there would be a physical fitness check. Could you introduce this to us? When we do this test, what percentage point of people fail to pass? Or have you assessed whether this will significantly hamper supply of professional drivers on the road? Thank you, Councillor Chow. We have been discussing this all along. I'm very grateful for all the valuable input you have given all along. The 3 points that you've raised about maybe, you could refer to the statistic on the pilot scheme for that. Maybe I invite my colleague to answer that. Thank you. Actually, towards the end of last year, we have launched a pilot scheme, the purpose of which is so that the physicians who participate can give us some feedback so that we could amend our guidelines to clarify and standardize our guidance. And drivers who participate are randomly sampled from the pool of commercial drivers. They could drive taxi, trucks, minibuses, franchised or non-franchised vehicles. They all participate. And only 3 of them failed that test. And they all failed because of their sight. And as the Secretary had mentioned, what they need is correct prescription glasses. So we believe, in terms of overall supply for professional drivers in Hong Kong, the adverse impact will not be an acceptable one. Councillor Chow also mentioned we want more doctors to deliver these services. Yes, we would collaborate with the Health Bureau on that, because after enhancing the restrictions on fitness checks, it is consistent with the overall aims of our government's health initiatives, help citizens monitor their own health. So we're going to continue to educate the public on that. Lothair Lam, please. So road safety is everybody's responsibility. This bill requirement, I'm sure, will help road safety. So 2 checks-ups every 5 years, I think it's a pragmatic requirement. On the one hand, we can enhance road safety, but on the other hand, we can reduce impact on the industry, and I support these proposals. My question is that, my colleagues have mentioned the fitness check fees issues. We do want to encourage more doctors to participate in this plan to reduce the costs of making this fitness check. And the document also mentioned that medical vouchers are applicable, but medical vouchers in the mind of drivers are for their own private use. So can there be further subsidize and support to reduce the burden on drivers? Because I know the Transport Bureau have some, plans irregularly. For example, a safety driver fitness plan and scheme. But that is not, that free health check is not linked with this health fitness check. If you waive the fee for that check, why not this one? You give it a free check, there's a report. It's basically equivalent to doing the fitness check as well under this proposal. And secondly, I know that for franchise buses, they have to have an assisting driver search system and monitoring system. It is mandatory. And I know that some taxi operators have voluntarily installing this system already. This system is really good because I heard bus drivers' inputs that I heard bus operators tell me that thanks to this system, they are able to find some drivers with sleep apnea or poor sleep quality, etc. So will we perhaps encourage commercial drivers to voluntarily install that like driving assistance system, right, to enhance road safety? Thirdly, on the paragraph 20, in the future, doctors have to use e-health to issue health fitness certificate. And you also mentioned a grace period. May I ask, what's the timeline of the rollout of this policy? When does this have to happen? Thank you. So Councillor Lam has given great advice, and this is exactly what we're trying to do. We have always have a safe driving scheme. So simply put, this scheme is we are looking into it in two ways. Firstly, the line items monitored under this scheme, I would say, is more basic. For example, BMI, body mass index, cholesterol level, or chest X-ray. It does not directly correspond to areas where we think commercial vehicle drivers have to focus on. So maybe we can adjust the health check scheme in order to match the health fitness certification requirements. And secondly, under our bureau scheme, we accept we welcome commercial drivers of all ages to participate. If the policy's general thrust is more focused on more frequent fitness checks for drivers aged 65 and above, then maybe in terms of our target age group, we have to make amendments at that as well. We are actively looking into this area. Furthermore, on the implementation timeline, in the second half of this year, we expect to table a legislative amendment. The first half of next year, we do expect to roll out a major public education campaign directed at both drivers and doctors alike. We hope that we can start implement that. Next, Councillor Julia Lau. Thank you, Chairman. I'd like to also express my support of the fitness check enhancement scheme. I'd like to refer to Appendix 1 and how the comparison between how we do and how other countries do. I think, I guess we're closer to Japan, perhaps, particularly in the next few years, the ratio of elderly drivers will be high. I do know, people who are in their 80s who are still very healthy, still driving. So some councillors saying that, there has to be a maximum age limit. And I do want to know what countries actually do that. And in my conversations with, I agree with what Mr. Councillor Chow said, you have to think about their livelihoods as well. If someone's very healthy, if they're just driving and we fire them and ask them to find another work job, at the age, if in their 80s, probably they can't get hired in another job. So we have to think about that. Maybe they could be like autonomous driving. They just sit there to monitor the vehicle. That's an option. And as other councillors have mentioned, right, like there is no direct linear correlation between age and accidents, right? You can look at insurance premiums, like younger people actually have a higher chance of car crashes. So it is not necessarily the case that if we impose the maximum age limit at 80, then the overall accident rate would go down. So I think we have to be careful about this. That's a piece of advice. Yes, I heard your advice. Thank you. Next, Councillor Yu Pak Leung. Thank you, Chairman. I support this proposal as well. As we all know, there's a lot of focus on this in society, the issue of road safety and elderly drivers. When we can't just say that necessarily that the traffic rate accident is higher the older you are. You can't look at it this way. Sometimes it's not a positive correlation. But I think this is a pragmatic compromise, in my opinion. Like people age 65 or above, you have to do a fitness check, and if you're 70 or above, it's an annual check.
The Secretary said that the assessments should be standardized, the process should be electronic, information should be transparent. Well, I would like to add that this physical fitness check must be convenient. The Secretary said that you will consider bringing in self-service health check kiosks from the mainland. So there would be an automatic or automated machine for the check. Well, when I renew the license on the mainland, I have experienced that it is very convenient. So by using that approach, the cost will not be so high. And then people's concern about fees of the test can be addressed. So have you done some assessment? I do not have a lot of data for CV drivers. There are around 1.1 million CV drivers. For franchised bus, I think you have the data. For people who are 60 to 69 years old. For those over 65 years old, how many of them hold CV driving license? Have you done an assessment? After the new law takes effect, so there will be an overall demand from the government's point of view. If we erect self-service health check kiosks, what will be the cost effectiveness? Now, people will be worried once this law comes into effect. Then every year there are many 10,000 people who will have to take assessment, and the fees will be in the hands of the medical practitioners. Have you got this assessment, Secretary? So just some information. Just now, our discussion is such that if we tighten the age requirement in relation to physical fitness test, and if frequency has to be higher, then there will be impact on the trade, and there will be demand for related medical practitioners. Now, for CV drivers over 65 years old, there are 126,000. And just now, the member talked about self-service health check kiosks. We have done some research. For those kiosks, they can carry out simple, clear, objective tests in relation to visual acuity, hearing, and also simple response. So these items can be tested. We have to consider the convenience and also whether we can subsidize the arrangement. So if we require physical examination, if certain illnesses or physical disabilities are to be included, these self-help kiosks may not be able to accommodate the requirement. Besides, we need to consider also the back office support and medical team behind the self-help kiosks. So we have to do further studies about these resource requirements, but it doesn't mean that we will delay the whole thing. Apart from the mainland, in Korea, we know from certain information that in February this year, they put in place simulators to examine the physical fitness of CV drivers. I believe technology will advance fast, so we will move towards more convenience and adoption of technology to enhance our efficiency. Thank you. Next, Mr. Kenneth Lau. Thank you, Chairman. In recent years, people are very concerned. So will age affect traffic accidents? Because all along, there are quite many traffic accidents. So now the administration's proposal about enhancing physical fitness certification requirements, I'm in support because we are talking about public transport. For private vehicles, we cannot really regulate. My mother is over 100 years old. She is still driving. But for public transport, it's another thing. So regarding e-health, issuance of physical fitness certificates in the future, doctors must go through e-health to issue physical fitness certificates for aged drivers. Besides, there will be a transitional period so that there will be a dual track of physical certificates and electronic certificates. Now, coverage of e-health is high. More than 90% of the elders have been registered. But then statistics rely on transmission of data by public organizations. And in recent years, the upload ratio is less than 1%. So there are many reasons behind. So how can you enhance publicity and encourage more private organizations to use e-health to issue physical fitness certificates to aged drivers? And how are you going to set the transitional period? Commissioner, right, because they are in close contact with the Health Bureau in this regard. Thank you, Chairman. Thank you, Mr. Lau. We are working closely with the Health Bureau. As I mentioned earlier, now we are tightening the physical fitness requirement for CV drivers. This is in line with the overall policy direction of the Health Bureau because we just want to make sure members of the public are more concerned of their own health condition. So before the end of this year, after proposing this legislative amendment, in the first half of next year, we will work closely with different medical teams and organizations. And also, practicing doctors will do more briefing and publicity, hoping that they will take part in providing the service. Registered medical practitioners on e-health account for 80% of total number of registered doctors. And Mr. Lau talked about joining in the scheme and uploading data to the app. So I think we need to work with the Health Bureau and do more promotion together with the medical expert team. Regarding the transitional period, our plan now is that in mid-next year, this enhanced regime can be implemented. And then we hope that the transitional period can be a few months. So during that period, we accept physical certificate as well as e-certificate issued by e-health. All along, in CV drivers groups, we promote different policies, and feedback that we heard is that no matter how much publicity we do among CV drivers, I think their oral experience sharing is very important. So we hope that there will be a few months of transitional period. And then during that time, they can share their experience. Now, they may have already installed the e-health app, but they need to update it, and they have to know how to find doctors to do the assessment. So there will be a few months of transitional period. Ms. Christine Fong, thank you, Chairman. For the sake of road safety, if we lower the age requirement down to 65 for physical fitness check, I'm in support. I know that CV drivers need to make a living. So Transport Department, can you do some studies about simulators and assessment centers? So can they be established in community health centers or rehabilitation centers and also post offices to make it convenient for CV drivers? And then there can be a one-stop service by doctors as well. Apart from health check, causes of traffic accidents are closely related to driving attitude. Just now, some of the councillors talked about driving auxiliary systems. Can they also cover minibuses and taxis? Apart from health checks, driving improvement courses are important. So does the administration have some data after attending driving improvement training courses? Can traffic accidents be reduced? Well, some members of the public got their driving license when they're 18, and then after even 40 years, they have not attended training courses. So, okay, are there some incentives in this regard? Now you ask CV drivers to get medical checks at age 65. If they take training, can they be given some rewards or incentives so that they have the incentives to renew or lengthen their driving license? Commissioner, right. Thank you, Ms. Fong, for her interesting suggestions. We will do some research on physical fitness assessment equipment. Overall speaking, we have to see how they can be used in Hong Kong to cover the items that we need to examine, and also to make things convenient for CV drivers. When it comes to convenience, I think it is about location. We need to cover various locations. You just mentioned community health centers and also community groups. They may have some designated centers. We will consider those. Regarding location, of course, this would affect cost assessment. So we'll take that into consideration. I agree with your point on driving attitude. So first of all, road design has to be up to standard, and vehicle safety examination has to be in place. And then when we issue driving license, we also be very strict in our gatekeeping. And then regarding traffic accidents, many members said that there are different causes. Driving attitude is one of the reasons. So regarding driving improvement training, and also under the Employee Retraining Board, they have some courses for professional drivers. So regarding driving attitude, perhaps there should be more content regarding driving attitude that may be helpful to reduce traffic accidents. As regards review data after the training courses, perhaps we can communicate with Ms. Fong after the meeting. Thank you. So I will be the last one. I have a few suggestions. First, tightening age limit to 65 for physical fitness examination. This is a big improvement. In the past, the society attached importance to examination frequency. I think the content of examination is important. I have two suggestions. At 65, when there is physical examination, and if there are physical problems, 1 or 2 years later, if those drivers take another examination, well, you can consider a 3-year license. If drivers are 65 years old, they will then get a license till 70 years old before they have to take another examination. So perhaps you can shorten the validity period of the license so that they can take another physical fitness assessment to ensure everybody's safety. Now, for this examination, we mainly rely on private doctors in Hong Kong. Of course, we give them guidelines. We will communicate with these doctors, and I trust that they are professional. However, if there are amendments or if there are further requirements, the cost of communication is high because we have to communicate with each and every doctor. And then concerning pricing, well, the pricing power does not rest in the government. It is in the hands of the market. So we're talking about a few 100,000 people who need to take the physical examination. So I think the government should consider it. In the paper, it states that in the long run, the government may set up some physical fitness examination or assessment center. We can move towards this direction because there are so many people, so at least there are customers. Besides, this is an annual requirement. So for those health centers, as members suggested, well, these examinations can take place there, so at least you can reduce cost of communication, and the assessment standards can be more aligned with the government's requirements. In the future, perhaps there will be additional equipment, AI, to assist examination. So there will be some place for these equipment to be installed.
So I think the document raised a very important point as well. And that we hope that there can be some of these like health check centers to support this policy. And I hope that these several pieces of advice can continue to roll out. There's going to be more time for further discussions. I'm going to wrap up the discussion here. If you have nothing to respond, that's fine as well. Okay, Chairman, what you've said and what all the councils have said, when we go back to the department, go back to work, we are going to absorb and optimize all your input. And most importantly, in terms of the auxiliary arrangements, we want to be precise, convenient, and digitalized. Matter of fact, the core of today's proposals is precisely the licensing of commercial vehicle drivers have to be the health requirements have to be moved from age 70 to age 65, right? That's something that we do want to implement smoothly, and that is also that would be also make our arrangements here in Hong Kong consistent with many other areas abroad to change the bar for health fitness check to 65. Thank you for all of our councillors who in their communications have expressed that they too agree with this proposal. We're going to implement this as soon as possible. Okay, next agenda item is the issue of application for fare increase for Star Ferry Company Limited. So may I invite the officials to prepare to come into the room. Thank you, everyone. So we have going to have another team of officials coming in. So councillors who want to raise questions, please press the button now. Quite a lot of you. Try to be brief and concise. 3 minutes. Even if it's 3 minutes, it takes half an hour, and we do have to overrun. If you don't have to ask a question, you don't have to. Thank you very much. I won't be asking any questions myself. Yeah, if any of you don't need to ask a question, you could like press a button indicating that you don't. Are the officials ready? If yes, I'd like to let you deliver your presentation, but time is of essence, so please be brief, because people have already read the documents in advance. Thank you, Chairman. Good morning, everyone. I'll try to be brief. For today's project, the Star Ferry's fare adjustment proposal, we'd like to consult our panel. So Star Ferry is part of our public transport network. It has always been providing a efficient and cheap public transportation means to cross the harbor. And you know, this is a very important symbol of Hong Kong. It's very tourists love it as well. And on this proposal, we would like to help Star Ferry to expand into some non-fare related income to help alleviate the operational burden and to help with maintenance work of the harbor. And we also offer some rebate on the rent for the harbor and to waive some of the registration fee for their ships in order to help their operations. On the fare adjustment side, we like to consult our panel members, and as usual, we are going to monitor this closely. We hope that in terms of the financial sustainability and the affordability for citizens, we're able to strike a balance between the factors. We would like the panel to we're going to consider all the relevant factors before we submit it to the chief executive and with our opinion and suggestion on fare assessment. So I'd like the Star Ferry to colleagues to briefly introduce the operations. You have 3 minutes. Good morning, everyone. I represent Star Ferry in this proposal. So we are going to add $2 to $8 to our fare this time. So upper deck is going to $6.50. For weekends, it's going to be $8.50. For concession tickets, it will be $3.8 and $5.1 as well. So compared after we adjusted fees, we are still the cheapest transport. If you look at the cross-harbor MTR services, which cost $12. And furthermore, Petco ride service is proposed between Tsim Sha Tsui and Wan Chai, and the pass will cost $25 for the pet. We want to attract more tourists that way. So about our operation model, the fare box revenue is about 60% of our total revenue. For the rest, it's rental income, advertising income, and other income. Last year in 2025, we have about 81 million fare box revenue, and non-fare box revenue is 51 million. Look at our current operations. Even though our average daily patronage have recovered after the pandemic, but because of the MTR's development and changes in habit of our customers, has affected our business. If you look at this bar chart, on 2018, we on average we have 53,900 customers per day, but after during the pandemic is 26,000. But last year there's been some recovery, but it's still 44,300, which is still a 20% haircut from 2018. If we use $5 as a benchmark, so actually every year we have 20 million less revenue. In terms of operation costs, costs have been always high for ferries. On our operation model, every trip we need more than 10 people to help it operate, including both people work on the docks and on the ship. And they are getting older and older as well, and there's no younger generation entering the labor our team. It's recruitment challenges and salary pressure is very high. And vessels are aging, high maintenance pressure as well. We don't have the technical team to do so in Hong Kong, and the aging vessels would affect our operations and also be very expensive to maintain. Our total operation costs have increased from 114 million to 130 million, a 14.3% increase. And most importantly, there's not a lot of costs we can save. You can see that most of our fees are allied with salaries and maintenance. It's about 60% of total operation costs. And the fleet is over 60 years old. Our engines are very old as well. And we don't have the right components for maintenance as well. So we need to continue to deploy more resources to maintain it. In order to maintain reliable service and to increase customer satisfaction, we're going to have to launch a re-engine program as soon as possible to reduce maintenance costs. It costs about 10 million vessels to re-engine. We're going to re-engine 1 vessel per year starting this year. In the future, we're going to find enough new capital for our for our vessel, and from 2026 to 2031, we have recorded a total of 100 million in losses. We have to borrow money to continue operate. We still owe the banks about 70 million. Even though in April 2023, we got approval for adjusting our fare box a little bit, but it's still very difficult to make up for the accumulated losses in the past. Starting from 2026 this year, we expect to make a loss again. Sustaining our operations through borrowing from banks means that there's a lot of interest burden as well. So continued debt servicing costs and increased operational costs challenge our long-term financial viability. Okay, Mr. Chow, because we know everything about the long-term improvement and non-fare box income, everything. Let's stop here because time is of essence. Apologies. Okay, let me briefly go through the batting order and then I'm going to draw a deadline very soon. If you haven't pressed the button yet, do now. So Councillor Aaron Bok, Councillor Kenneth Lau, Jonathan Leung, Eric Yim, Vincent Cheung, Yu Ming, Lothair Leung, Lee Chen Kung, Chong Ho Fong, Christine Fong, Vivian Kong, and Yu Pak Leung. So I try to give everybody 3 minutes at first, but later on I may shorten the time you have. So please, questions and answers. It's not a lot of time. Councillor Aaron Bok, please. Thank you, Chairman. So raise of fares is always a very difficult choice to make. May I ask, on paragraph 5 on table 1, so the price have increased, and even for the elderly and kids, prices have gone up by 30%. Even for monthly tickets, it's also 30%. So in terms of a fare adjustment, I know a lot of tourists go on the ferry. Perhaps for tourists, like the 4-day ticket, the fare could go up a little bit. Because for tourists, even if the fare goes up a little bit, they will still ride the ferry. Like actually for like monthly tickets for daily use, that could be cheaper to strike a balance. And secondly, on paragraph 15, your document says that re-engineering would cost 10 million per vessel. So may I ask, if you're switching to a diesel engine, that doesn't really help the environment. Could you consider switching to a greener source of energy? That way you could apply for other renewable subsidies like green energy subsidies, and that could also help with your costs and help the environment as well. Thank you, Chairman. Thank you. Kirk. Thank you, Chairman. Thank you, Councillor Bok's advice and question. On the fare adjustment and for tourist ticket and monthly ticket, we take that into consideration. We hear you. And when we consider different factors, we are going to take that into consideration. As for the upgrade and renovation of vessels. May I ask perhaps Mr. Chow to supplement that? But right now, for the Environment Bureau, they have another subsidy which subsidizes testing of electrical vessels, and one of which will be deployed in the Star Ferry, hoping that we could test that at a new energy vehicle. Yeah, when you re-engine, don't re-engine into diesel. The re-engine, the plan is to one re-engine per year. So depending on technological development, we have, depending on how mature the new technologies are, we may consider other types of vessels as well. Let's see if there's any supplement from the Star Ferry team members. Be brief, please. Thank you for your question. So on new energy, we adopt an open mind. If we can work with this government timeline, we are more than willing to join these pilot schemes. Councillor Kenneth Lau, please. Yes, Chairman. So with respect to this fare adjustment, I do understand why Star Ferry proposed that because you have to maintain financial feasibility. But in recent years, a lot of transport have applied for increased fares for citizens and for tourists. This does affect their daily lives. I hope that in the future, when you make money, you could give back. So I have a question about making proper use of harbour space. So recently, there have been a report published about Star Ferry's franchising rights ever since 2018. And after that, they are responsible for the management of Central, Tsim Sha Tsui, and Wan Chai piers. But in 2023, there are 7 out of 50 shops which have been vacant for 90 consecutive days. It seems you cannot really make good use of such valuable land. Are there any policies to help them attract tenants to support their operations so that the market, the space of the hub and these docks could be made, we could make good use of these space to increase the revenue of Star Ferry? Thank you. Thank you for your question. Indeed, making good use of pier space to enhance other income sources is important. We are going to actively work with the operators and we have been consistently helping them to expand the amount of space that they could use for commercial use in their piers. If we look at the tenancy rate on all 3 piers, it's all 90 to 100%. It's pretty good. For some locations in the Wan Chai Pier, They also have some renovation work scheduled to introduce some new shops, new tenants to increase their non-fare box revenue. So Star Ferry colleagues, maybe we don't need that. So we have some plans to introduce more shops, yes, to increase the other non-fare box income. Yeah, anything to supplement, Chairman? So next question. Councillor Jonathan Leung, please. Chairman, firstly, I understand and support the fare adjustment. And last week, Councillor Lee and I, after we went on over the Star Ferry, it's $4 or one trip and $5 on the way back because we want to enjoy the air conditioning. The experience is frankly great. And any other ways to cross the harbour costs more than $10, but you maintain it at a single digit. We understand the fare adjustment, but for the sake of your long-term financial viability, you have to increase your non-fare box income. But in previous committee meetings, we have already addressed that. I know, well, to put it briefly, at Central Pier, there have been new plans of development. Can there be other measures, maybe we cut the red tape so that they could do more business to work with the new expansion developments in terms of maybe, you could do more in terms of more shops, more things you could do on the top floor, to enhance your income in order to maintain, to break even in your business. Thank you, Chairman, and thank you, Chairman. Thank you, the input from Mr. Jonathan Leung. In terms of the pier operational space, the Transport Bureau is working hard, and we work with the Development Bureau so that we could expand the scope and space that they could derive other income from commercial activities. So the operators have already hired a professional company services to help them attract advertisement or commercial events to attract more institutions, more companies to work with them. And the operators have been working on that all along.
Thank you, Mr. Eric Yim. Thank you, Chairman. I would like to express my attitude. I understand the pressure of Star Ferry in raising fares. After fare was increased in 2023, now it has not been 3 years yet, and this fare increase of 30% is quite high. So I think the government needs to strike a balance. Two questions. For the Wan Chai route in 2020, the engine was revamped, and then the number of passengers that can be accommodated is reduced from 523 to 399. So in the future, when the engine is replaced, will that be impact on the space or capacity of the cabin? Now, staff cost accounts for 60% of Star Ferry's cost. I think you should do some work in cost reduction and expansion of revenue. Now, there is automation. Have you looked into further automation or autonomous driving for point-to-point route? All right, Star Ferry, Mr. Chow. Thank you, Chairman. Thank you, Member. Regarding the overhaul of the engine and also the reduction of number of places or seats. So far, there has not been a concrete plan. It all depends on the size of the engine. We'll do further review later. We'll try our best not to change the number of seats. As regards human resources, there is limited space for automation because a lot of our work depends on colleagues' expertise and experience. For example, the anchorage of the vessel relies on human experience, but we will continue to review whether there is this kind of room. Next, Mr. Vincent Chang. Thank you, Chairman. As colleagues said some time ago, in relation to ferry service, PAC had done a review. So I hope that Star Ferry can refer to that discussion because there have been several rounds of discussion and recommendations, hoping to help you increase revenue and reduce costs. I hope the TD will follow up. There are 3 points I would like to raise about this report. First, make better use of the piers. No matter whether we talk about the Tsim Sha Tsui or Central Piers, there is still much room for further optimization. Near Central Pier, the Development Bureau has new projects. There will be new shopping mall. So I believe there can be a new hub there. I hope Star Ferry can do more studies so that you can bring more tourists there. The same applies to Tsim Sha Tsui. And then regarding the increase of fares, I do understand that you have the need, as colleagues mentioned, for monthly pass. I think you can charge a lower fare as much as possible, and you can increase fares for tourists a little bit. I think that would be a better balance. This morning, when I crossed the harbor, there was big traffic jam. It happens every day. So regarding the connection or the interchange between ferries and other modes of transport so that members of the public can have more choice in the morning. Now, with a new pier in the west, in the WKCD, some people go from Discovery Bay to Central and then they take the ferry at the WKCD. So the third point is about non-fare box revenue. There is big room. I have taken a ferry service which you work with some hotel groups. I think this is quite a good idea in the past. I think you were quite conservative. Perhaps you can work with the Development Bureau and also the Culture, Sports and Tourism Bureau. So there is a lot that you can do along the waterfront, but so far not much has been done. I think TD can give them some targets to achieve. Thank you. Thank you, Mr. Chang, for the suggestions. And also, I also thank the PAC for the recommendations. I do agree that non-fare box revenue is important to us. A task force has been set up by TD, and I can try our best to take into consideration various operators' plans, and we will offer a one-stop service to make things convenient for them. Next, Mr. Lothar Lam. Thank you, Chairman. I am in agreement with this proposal of fare increase because of operational difficulties. I think fare increase is a reasonable request. Well, I think there can be expansion of non-fare box revenue. I don't want to elaborate too much, but I do support the proposal about Petco ride service. I think this should be based on user pays principle. If the effect is good about Petco ride service, will this service be extended to Tsim Sha Tsui and Central routes? And then regarding the electrified ferry pilot scheme, I think Star Ferry would consider that in the future. Pure electric vessel may be difficult, but perhaps you can consider methanol as a fuel. I think you have discussed with some relevant organizations. Apart from electric vessels, will you consider other green fuels to replace this engine overhaul scheme? Well, concerning Petco ride, after opening up the Wan Chai service, we will see whether there is room for that. And then regarding other fuels or energies, we have an open mind. So if it is possible, we will take part. Thank you. Next, Mr. Lee Chun Kang. Thank you, Chairman. Star Ferry has been collective memory for many generations of Hong Kongers. So now they are proposing fare increase. I hope that they can continue the operation. Now there are not enough passengers. Some time ago, I have taken the ferry service and I saw some sparks out of the ferry chimney. So I believe that the engines really need to be replaced. After fare increase, I hope you can work faster with replacement of engine. Regarding non-fare box revenue, many members commented on it already. Now, when the piers become aged, the Star Ferry pier, especially the Tsim Sha Tsui pier, has been in use for many years. Is there a timetable with the Bureau about upgrading the pier? Perhaps there can be more stories and then restaurants can be established there because that is a good location. So in this way, there can be an increase in non-fare box revenue. Thank you, Chairman. Thank you, Mr. Lee, for your comments. Regarding the three piers, for the Tsim Sha Tsui pier, it is indeed a historical place which has been in use for a long time. So concerning revitalizing the piers, we are working with the operators to review the feasibility. As mentioned just now, the pier structure itself has a long history. So we have to look at the technical viability, the structure, the engineering requirements, and also operations. We do need to do a detailed study. And then we have to look at cost effectiveness and engineering feasibility. All these have to be taken into consideration. Next, Mr. Chong Ho Feng. Thank you, Chairman. When I read the statements, looking at increase in patronage, I do not have much expectation. But then regarding retail rental income, the percentage is rising. Now, in busy areas, we see many vacant stores, but then your occupancy rate is more than 90%, especially in Wan Chai. I know that you have done a lot. Do you have data about rental changes in past years? For example, what is the level pre-pandemic, and then right now, what are the changes in the rent? I want to know whether this KPI is derived from renting out at a low. And then this time, you need to take into consideration grassroots affordability. For monthly passes, they are usually used by the grassroots for commuting. Starting 2022, within 3 years, the cost increase is 15%. So I don't think you should increase fare by 30% for monthly pass. I think you should only raise fares by 15% in accordance with the cost increase. And then regarding the traffic diversion of the 3 tunnels, I think Star Ferry can do a lot. For example, you can work with shopping malls to introduce park and ride concessions. Now, I think it is very convenient for people to park their cars in Harbour City for those who need to work in Central. At the same time, you can also attract people who drive to work. So they aim at door-to-door commuting. And now people may go through shopping malls, and then they can do some shopping. They can also have a meal in the mall before they go back home. This can drive foot traffic and also the evening market in the malls. Thank you, Mr. Chong, for the comments. Regarding monthly pass and also the overall fare increase percentage, we have heard you. As regards your points on rent level and also interchange concessions, perhaps Mr. Chow can comment. Thank you, Mr. Chong. If we compare 2018 and 2025 about rent, there is an increase by 7.8%. If you take Tsim Sha Tsui Pier, per square foot rent, it is 200 odd. And then on Hankow Road, it's around $180 to $200. So we are not lower than they. And then cooperation with shopping malls. Thank you for your comment. We will work with the relevant organizations. Chairman, I want to declare interest. I have family members who work in organizations related to Star Ferry. Ms. Christine Fong. Star Ferry is iconic along Victoria Harbour, so their operation must be sustained. Now, this time we're talking about 30% fare increase. This is quite high to the general public. I agree with colleagues about monthly pass. I think they are regular passengers, and they are usually the grassroots. They really patronize you a lot. So how many such passengers are there based on your data? For tourist tickets, I guess there can be a mild adjustment. Secondly, I do agree that you can increase fare box revenue. For example, you can attract more passengers. Park and ride at Tsim Sha Tsui Pier, and then you can bring in more income. For non-fare box revenue, you can make better use of the pier space. At the Western District, there is a selfie spot. And then in Tsim Sha Tsui Pier, for example, you can consider some extensions, and this would not contravene any ordinance related to the harbor, and then you can put in place some selfie spots to increase your revenue. So have you considered that? Finally, I'm concerned about the engine. Now, I do agree that even though you are replacing the engines at $10 million, can you expedite things? So instead of one engine to be replaced in a year, perhaps you can think of replacing 2 every year. And then you can also consider the new energy transport fund so that the air quality around Victoria Harbour can be improved, and you can also attract more passengers. You can introduce the Petco Ride service. Yes, thank you. Thank you, Ms. Fong, for the comments. So there are 3 points. Regarding monthly pass, we have heard you clearly. Regarding Tsim Sha Tsui Pier, so perhaps we can beautify the environment of the vicinity. Now the pier is rather busy, and there may not be too much space nearby. We have to take care of the daily operation of the pier. We have heard this point. Regarding engine replacement, I'll defer to my colleague.
Thank you, Councillor. Thank you, Chairman. So it takes longer time to re-engine because it takes 5 to 7 months to do the entire process. And we have learned from past experience. After that, once we have more experience, we might be able to pick up the pace. Councillor Vivian Kong, please. Thank you. Like Star Ferry is a most economical cross-harbour experience. It's a shared resources for everyone. This high-value, perfect experience really brings forth the value for money in Hong Kong. And it's also one of the top 50 locations that we have to visit in a lifetime selected by National Geographic. So do you have any numbers on how much of your revenue is derived from tourists? And secondly, in non-fare box revenue, in the future, do you have any plan to collaborate with the trade to leverage this high fantastic value proposition that Star Ferry brings? And furthermore, if there's a multi-tiered pricing for local citizens and tourists, or maybe there's event-specific prices for when there are mega events on, then fares can go up a little bit. Will that be a good way to enhance competitiveness and increase fares at the same time to increase customer experience to balance out the increased fares? Thank you. Mr. Chow. Thank you, Councillor Kong. On non-fare box income, we are actively doing many things. For example, we are trying to rent out our shops, organize events, and every year we work with the Tourism Authority to collaborate on events, and we are going to launch a lot of IP collaborations as well. Furthermore, for more tourist mega events, thank you. I'd like to thank Councillor Kong's advice, and we're going to actively engage on that with other government departments. So next, Councillor Yu Park Leung, please. Thank you, Chairman. The Star Ferry is a very historic, sort of antique mode of transport. I think for tourists and for both citizens, it's very Hong Kong. It's very stylish. So the sustainable operations of Star Ferry is a shared goal for everyone. And we see that the costs keep rising in the past for almost 15%, according to the data. But in the end, I feel if you increase the prices all of a sudden by 30%, it feels too much. Particularly as many colleagues have mentioned, right? Monthly pass, right? Monthly pass is for local citizens using the Star Ferry as their day-to-day transport. So that part, especially that part, I believe 30% everybody thinks is too high. We are all very concerned about non-fare box income. But I know we've always been talking about looking into Star Ferry and rejuvenating the Star Ferry Pier. I hope that you could accelerate the pace on that front. Furthermore, with respect to introducing a new electrical vessels, right, with the EPD, I'd like to know more about this. What's the progress on that front? Can we pick up the pace? If we use electrical vessels, it's more environmentally friendly, the cost would be lower. I think that would be a great way, right? Stop trying out other engines because you're going to go back to fossil fuel engines. Firstly, it's not good for the environment, and if the costs are going to be higher than electricity, then maybe it's better if you just focus on the electrical vessel plants. Thank you for the Vice Chairman's advice. On the rejuvenation of the pier, we have some preliminary ideas already, and in the future we're going to delve deeper. The feasibility of the construction, the cost efficacy, these are all things we have to consider. The EPD plan also subsidize some operators, including Star Ferry, to have a testing of the electrical vessel. That's a fantastic opportunity as well, and we have reached a phase where we have found appropriate venues for charging on shore. We hope that once we start to deploy and accelerate the testing pace, we can see what challenges would it pose in terms of operations, what areas of note will there be. In the long run, we think that electrification of public transport is very much the way to go. Thank you. Finally, Councillor Chen Xiu-Hong. Thank you, Chairman. Star Ferry, tram, and the pier tram is also all iconic for Hong Kong. It's a fantastic opportunity to advertise Hong Kong, a very important vessel to bring out that Hong Kong narrative and story. So therefore, for the sake of its financial viability, I do not oppose their fare adjustment. I want to retain that iconic Hong Kong transport. But as many councillors have raised, just raising the fare alone is not enough to maintain the sustainability of your operations. In the long run, Star Ferry must increase their non-fare box income so that they could the frequency and the magnitude of the fare adjustments in the future need not be that great. Secondly, I'd like to ask about the cost matrix. So I understand that fuel accounts for 10% of your overall operational costs. I would like to know, did the Middle East situation impact fuel costs and drive up your operational costs, and what's your forecast for the next few years? Secondly, I know that you are going to upgrade the engines for your vessels, which cost about 10 million a pop per vessel. But compared with 2020 and 2021, you already upgraded the driver system for 2 vessels. The 2 combined costs only 16 million. It's only 8 million per vessel. So the price have gone up by more than 20%. I'd like to ask why. Is it material costs, salary costs, change in motor specs? Why did the cost go up? Mr. Chow, please. Thank you, Chairman. Thank you, Councillor Chan. On the oil price, in the first half of the year, that did impact our operational costs. Yes, even with government subsidies, our fuel costs have still gone up by a lot. Secondly, the 10 million re-engine fee. Back then, it's 8 million a year. There's inflation. There's also increase in raw material costs. The last time we re-engined was 2020, 2021. It's been 5 years, and prices have gone up in general. Thank you. Thank you, everybody. Because of the issue of time, we're going to wrap up our meeting here. I believe there are no any other business. Thank you, everyone.